Welcome to TelehealthFX Talk. This one is for the biohackers and the optimizers. The question we get more than almost any other is this: should I combine intermittent fasting with my GLP-1 medication? And I want to give you a real answer today, not a vague talk to your doctor. We're going to break down the potential benefits, we're going to go through the 4 specific risks that nobody is talking about, and we're going to tell you the sweet spot protocol that actually makes sense. If you want a clinical team that discusses nutrition strategy alongside your medication, not just the prescription, visit TelehealthFX.com. That's TelehealthFX.com. Let's start with why this question is so popular. Intermittent fasting has been one of the most dominant dietary strategies for the past decade, and GLP-1 medications are already the most effective weight loss tools in history. So the biohacker instinct is completely logical. If both of these things work, surely combining them produces a supercharged result, right? And the honest answer is it depends, but not in a wishy-washy way. There are specific situations where the combination makes sense, and specific situations where it actively makes things worse. Let's talk about the potential upside first. One of the most consistent patient experiences is that GLP-1 makes intermittent fasting dramatically easier. The food noise disappears. The craving that usually breaks a fast at hour 14 just doesn't come. So adherence, which is typically the hardest part of any fasting protocol, gets much easier on medication. And there is a metabolic overlap. Both intermittent fasting and GLP-1 medications improve insulin sensitivity through complementary pathways. For patients trying to reverse prediabetes or improve A1C, combining the two can produce better outcomes than either alone. But here's where it gets complicated, and this is the part the biohacking community often glosses over. There are 4 serious risks you need to understand before you attempt this combination. Risk number 1 is insufficient nutrition. GLP-1 medications already dramatically reduce how much food you want to eat. When you layer a fasting window on top of that and compress your eating to 5 or 6 hours a day, the combination frequently causes patients to eat far too little, specifically far too little protein. And we have covered in episodes 2, 17, and 19 exactly why protein deficiency on a GLP-1 is so damaging. You lose muscle, not fat. You get fatigue. You can experience hair loss. Your immune system weakens. Risk number 2 is directly tied to the first, muscle loss. Less protein intake plus rapid weight loss equals accelerated muscle wasting. Less muscle means a lower resting metabolic rate, which leads to a plateau, which leads to the frustrating cycle we covered in episode 19. This is the opposite of optimization. This is making the medication work against you. Risk number 3 is worsened gastrointestinal side effects. GLP-1s already slow down stomach emptying. They already cause nausea, especially in the early months. When you have a very tight eating window and you try to consume a full day's nutrition in 5 or 6 hours, you are forcing your body to eat more than it's comfortable with in a short time. This directly conflicts with the medication's mechanism. Nausea spikes, reflux gets worse, bloating intensifies, and patients quit the medication. Aggressive fasting is one of the most common reasons patients abandon GLP-1 therapy unnecessarily. Risk number 4 applies specifically to patients with type 2 diabetes who are also taking insulin or sulfonylurea medications alongside their GLP-1. GLP-1 medications alone are actually low risk for hypoglycemia because they only stimulate insulin release when your blood sugar is elevated. But if you add a fasting window to that combination, you can push blood sugar dangerously low. If you are a diabetic on multiple glucose-lowering medications, you absolutely cannot experiment with fasting protocols without direct clinical supervision. So what is the right approach? What is the sweet spot? Here's what the clinical evidence supports. The safest and most effective form of intermittent fasting on a GLP-1 is a 12-hour overnight fast. Stop eating at 8 in the evening, eat breakfast at 8 in the morning. That's it. This aligns with your natural circadian rhythm. It provides genuine metabolic benefits, and it doesn't compress your eating window so aggressively that you can't hit your protein and caloric minimums. If you are in excellent health, have high muscle mass, are not diabetic, and have 0 GI side effects, a 16-8 protocol, eating within an 8-hour window, can be appropriate. But the non-negotiable rule is protein first, every single meal. 25 to 40 grams of high-quality protein must anchor every meal in your eating window. That is what stands between you and muscle loss. And I want to reframe how you think about fasting on a GLP-1 altogether. Most patients on these medications are already naturally practicing a form of fasting because they're just not hungry in the morning. They're eating their first meal at noon without even thinking about it. The goal is not to aggressively add fasting. The goal is to intelligently structure the natural, reduced eating pattern the medication is already creating. And this is why having a clinical team that discusses nutrition, not just dosing, is so important. At TelehealthFX, the one-on-one onboarding with your licensed provider goes beyond the prescription. They look at your specific situation, whether you're diabetic, what your current side effect profile looks like, your muscle mass, your goals, and help you determine whether any fasting approach is appropriate for you. And because they also offer Samarelin for lean mass preservation, berberine for additional insulin sensitivity support, and NAD+ for cellular energy, they have multiple tools to optimize your outcomes during caloric restriction. 24-hour provider review, transparent pricing, no hidden fees, 2-day UPS shipping. Visit TelehealthFX.com. That's TelehealthFX.com. The bottom line, intermittent fasting and GLP-1 can be a powerful combination, but only when it's structured correctly for your specific biology. Aggressive fasting on a GLP-1 is not optimization, it's sabotage. If you want personalized clinical guidance that goes beyond just the prescription, visit TelehealthFX.com. That's TelehealthFX.com. Take the free qualification quiz, connect with a provider, and build a plan that actually works for your life. That's TelehealthFX.com. And as always, everything on TelehealthFX Talk is for educational purposes only. This is not medical advice. Do not implement any fasting protocol without consulting your healthcare provider, especially if you have diabetes or are taking other glucose-lowering medications. Individual results vary. Thanks for listening. Share this with anyone in your life who's been stacking fasting on top of their GLP-1 without thinking through the risks. We'll see you next time on TelehealthFX Talk.